Good afternoon, everyone, and welcome to session 1 of the Know Your Rights webinar series entitled What Rights Do Carers Have? My name is Sarah Judd-Lamb and I'm the Manager of Policy and Research here at Carers New South Wales. And I have the pleasure today of facilitating a session with some other guest speakers who I'll introduce shortly. Just a note to say that we are recording today's session, so if you would prefer not to have your video or name visible, you can amend that. We will be distributing the link later. Fantastic. So before we get started, I would like to acknowledge the traditional custodians of the lands that we are joining from today. Here in North Sydney, that's the Gorogal people of the Eora Nation. And I would like to pay my respects to elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people, including carers and those joining us today or via the link. So briefly, just an overview of Carers New South Wales. Most of you will be aware that we're the peak non-government organisation for family and friend carers in New South Wales. And I won't go over that in detail, but when we refer to carers today and in this webinar series, we are talking about family members and friends that are caring for someone with a disability, a mental illness, a drug and alcohol dependency, chronic condition, terminal illness, or who is frail due to age. Just to quickly go over today's session outline. Today's session is really an introduction to the Know Your Rights webinar series, which we'll provide some more information on shortly. And the aim of today's session is really to overview and introduce the series and provide some background and context. And then in future sessions, we'll be going into more specific topics. And so you can see there's a few introduction points that I'll go over. We then have Helen McFarlane, who I'll introduce soon, who speak to us about the Carers Recognition Act, and some other related New South Wales government initiatives. We'll have some time for questions after that. We'll then move through to thinking more about specific service systems. And then we'll hear from Georgie Burke, one of our carer representatives, about her experience making a complaint, followed by some further question time. And then we'll really speak about the future webinars and the fact sheets that are related to this series, and may get your input on how we can ensure that as many carers as possible know about those. So if we go to the next slide, this is just a list of the Know Your Rights webinars coming up. So today you can see there is webinar number 1, and we have monthly webinars happening for 8 months this year, always on Wednesdays, mid-month lunchtime, to hopefully facilitate some both carers and sector people to attend in their lunch break if they're working. And people are welcome to register for one or more of those sessions. We will provide the link after this session via email and also later in this presentation for people that would like to register for other webinars. And each of those webinars are associated with a published fact sheet. So if you don't want to wait X number of months to find out about that topic, you're very welcome to look at the fact sheet in the meantime, which should cover all of the same key information. And so without much further ado, I'll pass over shortly to Helen McFarlane, who is from the New South Wales Department of Communities and Justice. Helen and I have worked closely together on delivering this project, the Carer Rights and Complaints Network, that's developed these webinars and the associated fact sheets. Helen will speak a little bit about some relevant background to these webinars, and then we'll come back to some questions and then relate it to the rest of the webinar content today. So welcome, Helen.
Thanks very much, Sarah. Yeah, it's really great to be able to join you today. And thanks to Sarah and Grace at Carers New South Wales for organising the webinars. I'm working from my home office today, which is on Bidjigal and Gadigal land. So I'd like to also acknowledge the traditional owners of the land and elders past, present and emerging. So I just want to talk a little bit about the New South Wales Carers Recognition Act, because that's where I guess is the origins of this project. So and the rights as they are that carers have in New South Wales. So I just want to talk a little bit about the Act, which is a principles-based recognition act. It doesn't give carers rights or entitlements as such, but it does have significant value for carers in New South Wales. So I'm going to talk a little bit about what the Act broadly provides to ensure that carers in New South Wales are recognised and supported. Next slide, thanks. So the Carers Recognition Act defines a carer, and as Sarah said, that according to the definition that Sarah gave earlier, so the 854,000 carers in New South Wales are covered under the Act. It also establishes a New South Wales Carers Advisory Council, which is a direct carer voice to the Minister for Disability and Family and Community Services in New South Wales and to other government ministers. It provides, crucially, obligations for all New South Wales public sector agencies, and it enacts our New South Wales Carers Charter. Next, thanks, Grace. So the New South Wales Carers Charter is really how the New South Wales Government shows its commitment to the principles of the Charter by enshrining them in legislation. It's Schedule 1 of the Act, and it provides 13 principles under 4 headings for the support of carers. It was slightly revised following the 2016 review. But essentially the 4 kind of headings that the principles are grouped under are that carers, the principle that carers make a valuable contribution to our community, that carers' health and well-being is important, that carers are diverse and have individual needs within and beyond their caring role, and that carers are partners in care. And copies of the Charter and the download are downloadable from our website. And we've also got hard copy posters, including some Aboriginal design posters that are available for people if they want to order them from us. Next, thanks, Grace. The Act creates these obligations for all New South Wales public sector agencies. So that is government departments and local councils. So they need to take reasonable steps to ensure that their staff are aware of and understand the Charter. They need to consult with carers and organisations representing carers when developing policies that impact on carers, and they must have regard to the Carers Charter when developing their own human resource policies in recognition of their staff who've got caring responsibilities. Next, thanks, Grace. There are additional obligations for human service agencies in New South Wales, and they are those who are defined as public sector agencies that provide services directed at carers or the people that carers care for. So, for example, many local councils provide those sort of services. My department, health, education, a whole range of government agencies, I care, a whole range of other government agencies are required to reflect the principles of the Charter and report on their compliance. So we've got 4 summary reports on our website, and there's the link there to the website. You can look at them. So they cover 4 years. And they summarise the information that's in the annual reports from agencies across New South Wales, including councils, on what they're doing to implement the Carers Recognition Act. Thanks, Grace. I mentioned this statutory review of the Act, as it was this review that really led to the development of these complaints, fact sheets and the webinars. The Act specified a review after 5 years. So my department led the review, and my team led the review. Over 800 individuals, many carers, and 50 organisations participated in the review of the Act. Basically, the review recommended that the objects of the Act are valid and the provisions are appropriate. It provided insight into how it's being implemented and interpreted, and identified opportunities to improve outcomes for carers through increased education and other initiatives. The final report, which was tabled in Parliament in November 2016, had 10 recommendations. There were 3 minor legislative changes, and the other recommendations dealt with sort of implementation initiatives and policy and practice things. So again, that review is downloadable from our DCJ carer web pages. Next, thanks. So this here is recommendation 1 from the Act review, and it's really why we're here today. So the review found, and it's based on feedback we got from during the review, including from Carers New South Wales and other bodies and individuals, that carers didn't have much awareness about the statutory protections and complaint mechanisms that were available to them, and that there was a recommendation that we improve and facilitate access to carers to this information. So we agreed to establish with Carers New South Wales, who had already started a bit of work in this area, a formal network to map the key legislation and complaints channels, to share resources and examples, and to design high quality targeted information that would be of use to both carers and the agencies who were receiving or dealing with complaints themselves. So that was it's been a really good process, quite a long process, quite a complicated process, but it's resulted in some really excellent fact sheets and also the webinars. So just got one more slide as part of the context that we wanted to provide. So really all this work falls under the broader work of my team, which is delivering the New South Wales Carers Strategy. So all the work we do to implement the Act and reflect the Act is sort of covered under all of this work. So the new 10-year strategy was launched in Carers Week last year, along with a first of 5 2-year action plans. And as sort of highlighted there, action 10 of 29 actions in this first action plan is this project, Carers' Rights and Education. And we plan to build on the work that we're doing with the webinars and the fact sheets over several action plans. It's a sort of a longer term project, but it's expressed in the action plan as the project being to empower carers to uphold their rights via formal complaints and appeals pathways, and to raise awareness of the complaints in the complaints sector about carers' rights. So again, so I guess that's where this project, how it developed a bit, how it relates to both the strategy and the Carers Recognition Act. And as I said, if you go to that link on the website, then all of the documents I've referred to are available. Thank you, Sarah.
Great, thanks, Helen, for that. So to recap, I suppose, introducing this context of the Carers Recognition Act, the review, the Carers Strategy and the Rights Project and the fact sheets and webinars is our way of introducing the fact that there are a range of expectations and rights that carers can have, but in the short to medium term, what DCJ and Carers New South Wales and our network would like to prioritise is really getting a good understanding of what legislation actually holds enforceable rights for carers that can be upheld through formal complaints mechanisms. And so the remainder of this session and the remainder of the series really will focus on that, but the Carers Recognition Act is an important foundation. And even though there's not sort of a specific legal rights pathway or complaints pathway attached to the Act, as Helen said, there's a lot of scope within when carers are engaging with government services to be able to voice those expectations if issues arise, to be able to raise them with ministers, with organisations like Carers New South Wales to have those things addressed. But really, I guess in that context, we are then narrowing for the rest of the series to look at what other pieces of legislation and organisations and agencies are available that have specific rights for carers. So we'll touch on that briefly, but before we do that, I just wanted to see whether anyone had questions. One question I guess we might have for you, Helen, is in the project that's been looking at rights and the carers strategy, have you seen any progress in terms of awareness of carer rights and complaints so far?
I guess that's something we'll be looking at in terms of how we monitor the effectiveness of all the actions that we're looking at, including this one. I think that there's what it has achieved already through the process of developing the fact sheets and now the webinars is a bit of a community of practice through the people who are involved in the network about dealing with carers' complaints, and I think probably that they have been then therefore more able to think about how they deal with complaints that they might have that are either from carers on behalf of themselves or from carers on behalf of someone that they're looking after in relation to their services and support. So I think there's probably more readiness and more awareness from the agencies that are likely to get complaints. I'm hopeful that there is a bit more, there's visibility around the issue more as a result of the project. And I know you've done quite a bit of a few presentations on it and some conference presentations and things. We've promoted the fact sheets through a newsletter that we run with our stakeholders, and it's also available on the Service New South Wales Carers page. So we're hopeful, and we are looking at the number of hits and things that page gets. So it'll be something to think about really with this project, how we do assess the visibility and people's increased ability to understand what their rights are and increased willingness to sort of make and follow through complaints. So probably an ongoing discussion. I don't know what you're feeling about that at this stage.
Yeah, so I think we'll definitely be looking to track. So for those that are listening in today that have seen the fact sheets, and for those that haven't, there's on the web link, which is in the original flyer for this event, and also which we'll send around later. There is a feedback form. We've had some responses to that in relation to the fact sheets. We'll also be sending out an evaluation form or feedback form on each webinar, just capturing who's there and I guess how they feel the information has been. And we certainly have found so far that we've been getting a lot more inquiries from carers directed to Carers New South Wales about people's rights and complaints pathways, and internally from our staff as well. So I think putting out information about rights in terms of the flyers for these webinars and the fact sheets themselves, there seems to be a bit of a raised awareness in the sector and among carers that we work with around there being rights and complaints options. So certainly welcome any carers that are listening to this and sector representatives as well who might be listening to this link to feel free to contact Carers New South Wales about rights-based questions and certainly to promote the fact sheets. And we'll sort of, I think, towards the end of this session, look at ways that can happen because we're really keen to get these messages out to carers, especially around the specific complaints avenues in each sector. Which we've worked hard with our the complaints agencies in our network to develop. So unless there's any other questions, we can probably move to the next part of the session. So coming back to the presentation slides, we've gone to questions. So when we are looking at these webinars and in the fact sheets, which you'll see if you have a look at the individual topics, there's a range of pieces of legislation which, unlike the Carers Recognition Act, have specific enforceable rights that carers have that can then actually be tied to complaints pathways. And that's really what the rest of this series is interested in looking at. Under specific legislation, what rights do carers have, and then how would they pursue those rights? And most of those rights relate to accessing service systems with or on behalf of the person they care for, but some are on their own behalf. And so this slide is not comprehensive because we don't want to give too much away from future webinars, but just an example, I guess, of the scope that we're looking at. Because a lot of carers and a lot of service providers aren't aware that carers do have specific rights under, for example, the legislation on this slide. So under the NDIS Act, under the Mental Health Act, under various pieces of discrimination-related legislation, under the Fair Work Act, under the Aged Care Act. So there are others as well, but those are the main ones that we draw on in the fact sheets. And the great thing about that is that these acts kind of include carers in a whole range of groups that are entitled to specific things. And so then complaints agencies that are linked to those pieces of legislation provide pathways that carers can use. And we are working with a lot of those complaints agencies directly on this project, and they have said to us that they don't have many carers make complaints. And so one of the aims of this project is to increase those complaints because they are able to help with issues. So again, not comprehensive list, but the complaints agencies that, as an example, carers can contact with various complaints, as we note in later sessions of these webinars and in the fact sheets. They include Fair Trading New South Wales for consumer rights issues, the Healthcare Complaints Commission in New South Wales, Anti-Discrimination New South Wales, the Commonwealth Ombudsman, the NDIS Quality and Safeguards Commission, the Australian Human Rights Commission, and Aged Care Quality and Safety Commission. We work with all of those agencies directly, and we'll hopefully have representatives from most of those appearing at future webinars to talk specifically about their processes. But all the things that carers need to know about their rights specifically are detailed in the fact sheets that are available already, and then we'll cover that as well in a webinar format later on in the year. So that's just a bit of an overview of what we're looking at when we think about legislative rights that can be enforced through complaints mechanisms. And so we wanted to, in this first webinar, as well as kind of setting the scene for the rest of the series and for the fact sheets, we wanted to also bring in a carer voice, which is a very important thing to Carers New South Wales and to DCJ, because we want to encourage carers to use complaints pathways. We recognise that they're not always easy to navigate and that carers don't always get the outcomes they want. But definitely there's more carers that could be upholding their rights through those processes and potentially getting good outcomes. And so we wanted to bring you an example of a carer that is in our network who has used a complaints process that's kind of represented in one of the fact sheets that we have, and to talk about that experience briefly, just to give carers an idea of, you know, what's involved, some of the good things, some of the challenges, and just as an encouragement to give it a go. So we will be talking to one of our Carers New South Wales carer representatives today. And if people are not familiar with the carer representative program, it's a network of volunteers that Carers New South Wales trains to really do opportunities like this, to speak from behalf of their lived experience as a carer and help raise awareness about carers' needs. And so we're very pleased today to have Georgie Burke, one of our carer reps, joining us to talk about her experience looking at the NDIS complaints pathway. So each sort of services sector, each big organisation will have their own complaints pathway. They'll be able to advise on the specifics of that. Our fact sheets try and capture the basic information about it. And in the NDIS context, many of you that might tune in will be aware of that or familiar with that. There are specific steps that are set out as to how you might raise and then escalate issues. And you know, as the peak organisation for carers in New South Wales, Carers New South Wales is aware that there are still issues that are hard to resolve. And so, you know, we want to make that disclaimer that we're not saying every problem with the NDIS will definitely be solved immediately by making a complaint. There are system issues that we continue to advocate for, that carers continue to advocate for. But we're really pleased to be able to speak to Georgie, who actually had a positive outcome as a result of going through a formal process. And so I wanted to say welcome to you, Georgie. And did you want to say anything briefly to introduce yourself, or should we just get straight into the questions?
Oh no, but just thank you for inviting me along. Yeah.
Fantastic. Well, let's get into the questions. So you care for someone that accesses the NDIS. And could you just outline for us briefly what the issue that you had with NDIS services was that prompted your involvement in the complaints process?
Mm-hmm. So this was the first plan for my daughter, who's 16. It was 2017 we rolled out down in Wollongong, and the first plan came back with really sort of very, very insufficient sort of amount of funds. We'd been waiting for 2 years to be able to get safe access to the house and the bathroom because ADIC, you know, had stopped funding with the NDIS rolling out. So we were getting very, very desperate to have that situation resolved. And then the plan came back with no funds for home modification and no funds for all the really significant OT assessments that are required. And there was also very, very reduced funding for allied health generally, for the physio and speech therapy. That was really basic support that my daughter needed. The goal, so the number one goal was to actually have safe access to the house and the bathroom. So that was kind of clearly sitting there. And at the meeting, I had done an enormous amount of preparation with the help of one of the agencies in Wollongong who provided free transition support. So we were really, really prepared. I had all the reports, everything was there. And then I got the plan back and, you know, there was just all the essential stuff was missing. Yeah.
A common experience, I think. We've definitely heard of other carers having issues with plan coverage, even to this day, with first plans and subsequent plans. And so I guess, you know, there's a number of ways that carers might respond to that or address that. And I'm particularly interested in how did you know that there was something that you could do about that issue?
Well, I think partly there were a few different sources of information for me. One of them was the transition support that I had. So she was very knowledgeable about where to go next when the plan came back, so badly. Also, I happened to be working at the time in a casework environment. So I was surrounded by people who had knowledge of the channels. There were like caseworkers and Ability Links staff were also in the office. So they were able to say to me, they actually gave me the flow chart for Illawarra advocacy. And that gave me an idea of, what the actual step-by-step process was. And that initial step was to request an internal review. So yeah, I was quite fortunate really to have so many knowledgeable people around me. And I didn't have to call the NDIS on the phone. And at that early stage, you actually rarely got someone on the phone. So yeah, I was very fortunate.
And I think that's a common experience as well. And certainly I think the carers that we speak to who have made complaints and are aware of those pathways are often people that are involved professionally or have contacts that can help them through it, because it is a complex space. And that's one of the reasons we've wanted to do these fact sheets and webinars, so that it's more accessible to people that don't have a background in the sector, and to people that aren't professionals, because it can be daunting. They're big systems, the processes are complex, and the fact that organisations like the Illawarra Advocacy are able to make kind of resources that would show the process is helpful. And so that's definitely part of the role, I think, of this project, is filling that gap a little bit, so that carers can, in a first instance, find that basic information about the different processes for each service system. And so can you tell us a little bit, Georgie, what steps did you have to take in order to make the complaint, and how did you find that experience overall?
So I think probably the key one, which I think you make reference to in one of your fact sheets, is actually knowing what the problem was, being clear in your mind about what was missing and what you want resolved. And in this case, with the complexity of the NDIS, when you get the plan, actually being able to understand that plan when it comes in, that in itself is quite challenging. So, I mean, I could see that there wasn't money for the home modification with the help of the transition support I had. But there would be a lot of people out there who would not even be able to interpret a plan. So I think, yeah, for me, it was being clear in my head, what I actually needed resolved and where I needed changes to be made. An example of something that I didn't know about was the fact that there wasn't plan management, or I didn't actually even know what plan management was. I knew about support coordination and how important that would be for me as a carer, but I didn't understand plan management. So when I was going through these steps, somebody said to me, "Oh, you need to ask the plan management, so that's going to take, another load off your role." So yeah, that's the most important thing to get going. But then, so I got the correct email address, which took a while, and I submitted initially a plan. What was that form? Request for review of plan form, I think it's called. So I did actually submit that, and then after that I emailed. I don't think I got a response from them about that. And then a week or two later I emailed the feedback email with a very detailed and very personal description of what the problem was. And I really kind of was very, very personal, so that they actually understood the impact on my physical health, my daughter's hygiene, her immune suppressed condition, and the impact of not having an accessible bathroom was having on her. how long we've been waiting, you know, the stress levels. And I think I also made comment on the complete lack of disability awareness of the LAC staff, who were the initial planners. And then by the end of the day, I'd actually got a response from the assistant director for the region saying we need to organise an appointment. So we had a face-to-face where we started all over again and had a very, very detailed assessment of the situation. And then she went away, developed the plan, and then emailed me a draft. And then we sat down again face-to-face just to make sure that I was happy with the draft. And then the next day it was uploaded into the portal. So yeah, it all happened within a space of 3 weeks. Partly because she was going on maternity leave, I do have to say that. So her first email was, we need to get this done in the next 2 weeks.
Great, so you submitted a form, emailed sort of specific feedback email, provided details, then they were able to get in touch with you, formalise that process. And I know you kind of touched on it briefly before, but what was the outcome that you were aiming for from engaging in that process, and did you get that outcome?
So the outcome was to have more funds. And yes, we definitely got more funds. And she added plan management in. And probably another outcome, which is, you know, just as important, was that I was actually working with somebody who had disability awareness. I found that initial meeting with the LAC very, very insulting. And yeah, to actually be received by this woman who was the assistant director, who apologised and was very just really, really understanding of how confronting that whole early phase of transitioning into the NDIS can be. So yeah, that was extraordinary. That was an outcome, an unexpected outcome. Yeah. And yeah, it was amazing. It was very empowering to have that experience with her. Yeah.
That's fantastic. And obviously it's a while ago. NDIS processes have changed a bit. There's probably more specific steps now around complaints that are spelled out, which we cover in our fact sheet. And people that have engaged with the NDIS in previous years will know that there were some early teething problems. You know, there's been lots of reviews and things changing. But I think it's great to hear that even in those early days of rollout, just by raising something formally, you were able to have that addressed and air that with the right people, with the decision makers that were then able to progress that for you. And I think, you know, getting that information, knowing how to do that and pursuing it can be really worthwhile, as you can see from your experience in being able to have an outcome not only that you were looking for, but also some additional things that maybe you hadn't considered to help solve the issue. And that's really why we want to be encouraging carers to just familiarise themselves more with those processes and what their rights are, because sometimes, you know, sometimes it's more complex, but on other occasions it can just be a matter of raising the issue with the right person, and then you can actually get an answer, whether that's the specific answer you want or something that gets the same outcome. And so thinking about that, if other carers are tuning in just to kind of think about whether it's worthwhile taking those processes, what advice or tips would you give, Georgie, to other carers considering making a complaint?
Look, I think, as I'm sure most carers would agree, I'm extremely time poor. At that point, I was working 4 days a week. And I normally steer away from making a complaint because it's just way too time consuming and very confusing, the process. In this situation, to get very quick and reliable information on how to go about resolving the problem or making a complaint. Yeah, for me, it was about speed. that's why that email was just so good, having that email address, and not having to, you know, for quite a few months, I've been leaving phone messages and they'd be calling back when I was attending to my carer responsibilities or I was at work, you know, so speed and efficiency is probably my priority. And also knowing the right people to ask advice, knowing the right people to call in for help. So I guess I was fortunate that I had people in the workplace, in my workplace, to call on, so that was really easy. But yeah, you can often get advice that's not correct, which can make it very time consuming. And I think to put it in writing is really important, not just for the record, but you're communicating in a less vulnerable way. So yeah, I always try and put stuff in writing and save it. And then, yeah, that's probably it. Yeah.
That's great. And I think it raises some really important points as well that highlight the importance of these fact sheets and webinars, because you mentioned, you know, carers are often really time poor. We definitely understand that. You know, whatever we can do as Carers New South Wales to assist with that, to make it less time consuming, we will do. And so the fact sheets that we've done kind of are trying to, you know, it may not change the actual process, and complaints processes can be time consuming, that's for sure. But I think a lot of the time is often spent in finding the right information or sort of chasing your tail and going the wrong place, getting pushed around. And so I guess what we're trying to do with those fact sheets is to at least give carers the direct information about where to go. And so you mentioned, Georgie, having the right email address, knowing the process, saves time once we're actually able to give the right information to the source of the person that could then make a decision or make an action that helped. And sometimes, you know, carers have a minute to spare, they might ring a number, they get pushed to another number. And so Carers New South Wales is really passionate about simplifying that process and sending people to the right number. And as an aside as well, in this rights project, when we were working with complaints agencies, we've also been working with them to raise their awareness about the complexities for carers and to help them to understand that they might need to provide more simplified information or streamline that process. And one really great thing from a number of the complaints agencies we work with is just them being committed to not sort of giving another phone number and another phone number and another phone number to have that kind of ringing around thing that carers often experience, but trying to actually make sure that they can direct the complaint to the right place on behalf of the carer. And so that's something that both at the same time providing more information to carers about the right place to go and to simplify that process, also working with the complaint sector to improve that experience a bit for carers, because we very much recognise that it can be confusing and time consuming, and that often leads carers not to take it up. So yeah, getting the right destination, the right process. And the other thing you mentioned, Georgie, is knowing who can help and where to get trustworthy advice. So something else that we've incorporated into these fact sheets that will be covered in the webinars is for each service setting, if you need advice or assistance, where to go for that, where the official source for that is. So as an example, in the aged care context, there's a number of steps involved that are quite complex in order to make complaints. And there's a really great referral to the Older Persons Advocacy Network, which in New South Wales is the Seniors' Rights Service. And they will give you the right advice, they'll help with individual advocacy. So we've also made sure to include in those fact sheets where to go for help or where the best source of advice around the process is. Because obviously sometimes it can be overwhelming. You need someone to kind of help you through that. And similarly, in the NDIS context, there's NDIS appeals organisations that help with that process. So yeah, getting that right source of advice and advocacy assistance can also be really helpful in making that process more streamlined. So thank you very much for sharing your experience, Georgie. And again, I hope it's demonstrated for other carers and service providers listening that, you know, making a complaint can be complex, but it can also help with these issues that carers often experience in accessing service systems. So are there any questions for Georgie from the participants that we have today? We will be sharing this recording, as I mentioned, and I think, as Georgie said in responding to my questions, a lot of the things she's touched on are addressed in the Disability Services fact sheet, and so I'll highlight on a later slide that webinar will be coming up soon. I think in a couple of months' time. The fact sheet's already available, so for people that do have an interest in understanding the NDIS context, they can look there, and we're happy to provide further information about that as well after the webinar. Just the last sort of part of the webinar, we wanted to speak about the rest of the series and the fact sheets. So we've been mentioning those a few times. As I said at the beginning, this webinar is really to introduce the series, to explain the project, give people that are engaging in other webinars and fact sheets an understanding of where the project came from, and how to engage. So we will have in the next 7 months from now, the topics presented in webinar that I presented earlier. The website that is on the slide here and the example with one of the fact sheets beside it, that link is where you can get all of the information about both the webinars and the fact sheets. So if you haven't had a chance to have a look at the fact sheets yet, you can download them there directly. You can also fill out our feedback survey there on the fact sheets, which we invite you to do if you have further suggestions or comments around the fact sheets. That page also now has the flyer for the webinar series, which you're welcome to download and distribute. And it has the registration form links for each of the webinars. So we really encourage you to have a look at that. They are based on different service sectors and settings. So, you know, workplace is one, and then the remainder are kind of service systems. So you've got Centrelink and aged care, disability, whichever ones are most relevant to you as a carer, or if you're in the sector, ones that you are working within that you might be able to assist carers to access. You can download those there. The other thing that we really, I guess, wanted to have engagement on, and while we don't have that many with us today, we can still put the call out around how to get the word out, because you know, obviously from what Georgie was saying, it really relies a lot on who you know in many ways, or just being in the right place at the right time to get this information. And you know, we've had the privilege to work with some really key organisations to get these resources done. We're confident in the quality of them, but we really want to make sure that the people that need them get them. And so I don't know if you had any comments on that, Helen, around what the department's expectations are, and some suggestions about how we can get the word out there.
Yeah, look, we're really interested in seeing these the messages from and the information in these fact sheets get out there among the carer community. We've, as I mentioned earlier, we've put the link on the Service New South Wales Carers page. If people aren't aware of that, you go to Service New South Wales and search carers, and there's a landing page which has got a whole lot of sort of targeted information for carers, including basic services, these fact sheets, and also information about a lot of entitlements and benefits and things that carers may not know about, that they may be eligible for. So we're interested in promoting it. We'd love to see our partners promote it as well, the link, and yeah, really interested in people's thoughts about where carers might like to see the information appear. I mean, we know that carers are time poor. We know that they don't always go looking for information for carers. They don't Google carers complaints, you know, how do I complain? Probably they will sort of sometimes be looking more for information about the person that they're caring for. So always good to have some suggestions about how we get the information out there about the fact sheets and about the webinars as well.
Great, thanks, Helen. And as you mentioned earlier, the New South Wales Carers Strategy, this is a key project, Carers Rights Education. So it's something we'll be working on ongoing. Yeah. Carers New South Wales will be working on ongoing, department will be working on ongoing. And as I mentioned before, we're working with a lot of the complaints agencies that are responsible for these rights and complaints. So we really welcome people's feedback about that, and we will include, so we'll send an email after this session to all people that registered with both a feedback form about this session, but also some other information, including this link where the fact sheets are. And so feel free to respond to that email if you've registered, or otherwise to contact us at Carers New South Wales. I've seen whether I've got the, I don't actually have my email up there, our email up there, but feel free to respond to the email that comes out, or to visit our website. And the carer rights and complaints link that you've got in front of you has our contact information about the project as well. So visit that link in front of you, and contact our policy team if you have any suggestions, or you'd like hard copies, or how you'd like to distribute those fact sheets. And the other thing I should flag as well, so this link is where those fact sheets currently sit on the Carers New South Wales website. Helen obviously mentioned they're sitting on the Service New South Wales Carers page as well. Carers New South Wales is in the process of getting a new website, and we're hoping to highlight them even more on that website, which should be done in the next couple of months. And what that will also include is information on just tips around self-advocacy as well. And it will be linked to information about raising issues with our policy team, because really kind of when you have issues with services, there's a few different kind of options in that, you know, if you do have a service issue that is reflected in these legislated rights that we've been referring to, then you do have the complaints pathway option. Sometimes, you know, maybe your experience is related more to the Carers Recognition Act, but there's not a firm kind of pathway for you to make a complaint about that, or for that to be enforced. And so there's other ways that you can address that, whether it's through self-advocacy with the service themselves, whether it's working with a local member or a minister around an issue. And then similarly, if it's a problem that lots of carers are experiencing, it may be something that you want to raise with the Carers New South Wales policy team, because we do system advocacy on behalf of all carers around common issues. So with the new website, that hopefully that information will be all together, but it is also available on that link that's on the slide. And the main thing, I guess the main message to get out really is, you know, the carers, there's a lot more that it's available to carers to improve the service issues they have. And that those of us that can are working on ways of making that more easily available, noting that, you know, it's just one other thing that carers have to do. So the picture there you can see is one of the fact sheets. Have a look, let us know what you think, and please do register for future webinars. I believe our next webinar is aged care services. I think so, I'm trying to remember off the top of my head, and that'll be the middle of next month. We'll be having guest speakers similar to today, of people that sort of have particular knowledge in that context, and we welcome your pre-submitted questions as well through the registration process. So that is all the content we were planning for today. And unless there's any final questions or comments from our guests.
No, I'd just like to say thanks to Georgie for sharing her. Nearly forgot your name, Georgie. Thanks to Georgie for sharing your story today. It's great to hear, and a good outcome for you. That's great.
Oh, thank you. Yeah, no, it was a great experience. Yeah.
Yep. Good.
Yeah, my only comment about the, you know, the access to the information about complaints is, you know, there must be a lot of carers who would find that they wouldn't know that they're there, obviously, and maybe they don't even know that you guys exist. And I just go back to the old days when we used to have case managers, you know, and they were kind of there, and just that whole, I guess because I've got a casework background and I know that one-stop shop kind of approach that, you know, used to be around, and it's so hard certainly in the NDIS world. The NDIS has kind of shattered that in a way. All I'm trying to say is, I could ramble about it for ages, but how to kind of get back again some system where, you know, case managers, or there's some a therapist or whatever who can be across a lot of different things. Like I know Liv's physio, with her background. We'll point out different services because she's so knowledgeable. And I'm just wondering whether you can target support coordinators or large disability services, for example, like the Disability Trust, because they are trying to develop as much under one umbrella as they can, so that, you know, carers don't have to look, but they're actually told, you
Yes.
know, it's not something that they have to try and find because they're just not in that headspace. Yeah. So a really great support coordinator should be doing that. And I don't think plan managers, even, like, we've got the most extraordinary plan manager who kind of puts the support coordinator hat on as well. Yeah.
Getting it to those key people, and I think for future webinars, the fact that they are topic based, I think probably what we'll be doing is for each topic looking at specific promotion and getting buy-in from key organisations that will, because for some organisations like the Disability Trust, really the disability fact sheet is the one that is of most relevance, and so whether they can share the link on their website or promote the session to their networks, that's definitely of interest. And so if anyone that's tuning in today has direct contacts with those providers, works for providers, you know, receives services from providers, or has suggestions about specific websites or Facebook groups or other sources where either one or all of these webinars or fact sheets would be of interest, we're very happy for you to share those, sharing the link that we provided earlier, and just getting the word out. And we are happy also to receive suggestions for organisations to approach that might be interested in finding out more. I know we've already had one inquiry from a service provider to do some training for their staff about the particular topic that topic area that they work in. And certainly we're working with our staff at Carers New South Wales as well to be aware of those issues. So I think we're just running a little over time, so we can probably wrap up there. But I noted the comments from Natalie and Leanne, and Natalie's also thanked you, Georgie, for sharing your experiences. We look forward to hearing from you. Please keep an eye out for the email sent this afternoon with the feedback form and further information. And we hope to see you at future webinars.
Thank you.
Thank you.
Thanks, everyone.
Thank you. Thanks.